Hello everyone, welcome back to the See the Stories on the Theatre News Show. Now, before we jump to our discussion, I am going to ask my colleague Krizia about her experience, when you were pregnant.
What?
Did you do any exercise during that time?
Unfortunately not, because I was in a high-risk pregnancy, so I had to go on a bed rest for like 3 months, and then it was extended, so eventually until I gave birth.
Right.
So yeah, I didn't get any chance to exercise, though I really wanted to do it so badly.
All right, that's okay because everybody has their different experience, different condition, right? Because I have one also with my wife, but we're not going to talk about my wife, right? We're going to talk about exercise and pregnancy.
Okay.
Maybe later. Now, in the studio today, we have Coach Azani Fitria, a pre- and postnatal corrective exercise specialist. She will explain to us about pregnancy and postpartum exercises. Now, Coach, thank you for coming in.
Thank you, my pleasure.
Studio, yes.
What interests me the most about what you said earlier is this one, corrective exercise.
Yes.
So does a woman needs to do a corrective exercise before doing like regular exercise?
Yeah.
When they're pregnant or after they give birth?
Okay, basically corrective exercise is strength training. Strength training, or maybe people knows strength training as a training with lifting the weight,
Yes.
with barbells, dumbbells, but no, it's not. It's not always using dumbbells or barbells. Sometimes we can use our body weight, but the term corrective is actually reverse to how we deliver the training for mothers in pregnancy. Sometimes experience pain or discomfort during the pregnancy or after birth. There are some situation like diastasis recti or the stretch of the abdominal muscle that needs to be correct after birth. Nah, that's why most women before and after birth have to go through corrective training.
I see. So in other words, this specific exercise accommodates the needs of, pregnant women or people who have just gave birth.
Exactly. So now, what are the because again, exercising just in general, what are the benefits of exercising during and after?
Okay. We all know the benefits of exercise in general population, but when we do the exercise during pregnancy, the benefits not limited only for the pregnant women and during childbirth, but also after birth and even for the baby.
Okay.
Let's name it. Less physical discomfort, easier labor, reducing the risk of C-section, even reducing the possibility of high blood pressure, and the baby will get better health after birth. And most women who being active during the pregnancy, after they will have a smooth and fast recovery after birth.
Okay.
Oh.
Yes.
So that's one thing that probably most women need to learn about, because I think again back on individual condition, right? Because you had one. Again, speaking from experience, my wife had one. Again, if somebody is healthy enough to be able to do these exercises, I think it is best for them to be doing it, right? Because it's going to have a very good, maybe long-term effect too, right? So after the birth, also you're going to feel that.
Is there any explanation as to why regular exercise can help the recovery process after birth?
Yes. When we pregnant as a woman, many things change.
Right.
Let's say the biggest part of our body is the posture. Let me show you.
Okay.
Let's say this is the pregnant belly. When the growing uterus put here in front of our body, and then the gravitation move our body forward.
Yeah.
And it changed a lot of things. One, it very painful on your back.
Yes.
And it stretch your abs, and your core is also affected. And people think it's just nothing. Your posture doesn't affect your what should I say, element or the pain you feel in your body. It doesn't have to do have nothing to do with your posture. In fact, it's the biggest part, the biggest impact. Nah, when we exercise, we help our body to have a good posture during pregnancy.
Okay.
That one thing that affect the changes of the body, yes, during pregnancy.
Wow.
Yeah, very interesting.
Yeah.
Now, again, not too specific, but if because I think we're gonna do some exercises later here. But let's say, is yoga safe or Pilates safe? Just wondering what kind of exercises that pregnant women can do during that time.
In general, low to moderate intensity training is considered safe. But yeah, let's say yoga, strength training, strength training is also safe. Pilates, swimming, brisk walk, it's also safe. But what I want to highlight here before pre and postnatal mothers want to start exercise, you have to get medical approval from your healthcare provider.
Okay.
It might be your midwife or OBGYN. Make sure you get the approval first, because they the ones who knows your situation and condition.
I'm
It's just
totally
like
agreeing with you, because you know what? Right now we're living in the social media era. We are seeing so many pregnant ladies on Instagram, let's say, they are performing high impact exercise, even like, running marathon, but you just cannot put yourself in that position, because each pregnancy is different.
Right.
So you cannot just do that without consulting with the midwife or doctor. So yeah, thank you for highlighting that.
Yeah, you're right.
Right? Okay, now sometimes pregnant women, they're afraid of starting to do exercise.
True.
So could you please explain to us the red flags that they need to consider? Like, for example, they did this exercise and then they experienced something. What are the red flags?
Okay, pay attention to this sign or symptoms if while you do the exercise or before the exercise. First, vaginal bleedings. It's a big no-no. And then the second one, fluid leaking from the vagina. It might be your water break, amniotic fluid.
Yep.
And then the heavy headache.
Okay.
And then if you experience muscle weakness or uterine contraction, I would suggest you to stop or pause for a while, or even just go to your doctor and ask for their opinion about the condition.
Better safe than
sorry.
sorry.
Get yourself checked immediately once one of those things happen during it. Now, frequency-wise, we know that it's going to be really low intensity, maybe low impact too, right? The kind of exercises that the pregnant women have to do. Now, frequency-wise, are we talking about 2 to 3 times a week is good, or again based on everybody's condition? Because some mom could probably do 3, some can only do once a week. Is there any guideline?
The best recommendation is 150 hours per week.
150.
So
we can spread over maybe 5 times or 4 to 5 times with 20 or 30 minutes. Or if you consider to join a group class, prenatal or postnatal class, group class, the duration will be between 60 to 70. So you can go twice, 1 or 2 twice a week. It would be ideal.
I see.
All right. 150 minutes a week.
And then you can arrange the
and
schedule
then you can
yourself.
Spread it out.
But coach, sometimes women experience discomfort after they exercise. Do you know any ways to perhaps prevent that from happening? And if that happens, is there anything that we can do I mean, if it's really serious, of course, we have to visit the doctor, right?
Yeah.
But what if it's just some light discomfort?
Okay. If it happens during the trainings or the exercise, you should stop first. Pause, at least pause, and observe. Is the symptom or the pain relief by resting or by breathing? Sometimes the pain just release with the stretches and breathing. But if it doesn't go, just stop the training and consult with your coach. You have to find out where the pain is coming from. Like many pregnant women experience pain in the lower abdomen or lower back, tailbone, or even the pubic bone. And it makes them hard to move, to exercise, and sometimes it demotivates them to exercise even more.
Right. And it's good to have a coach that has some background in the healthcare industry. Like Coach Ani right here. Interesting fact, fun fact about her.
Thank you.
She is also a midwife.
Yes.
Well, we're going to talk about that more on the next segment, but we're going to have to take a little break right now. We are still going to continue with this discussion, and also maybe you can demonstrate and teach us some of the exercises.
Of course.
There you go.
There you go. Do not go anywhere. Stay with us on the 3 Hour News Show on C Today.